Students, I, Dr. Sarika Gautam, welcome you all in today's session on Logbook 3 of program Diploma in Hospital and Healthcare Management. I hope my screen is visible to all of you. Can somebody confirm? You can unmute and tell me. I hope my screen is visible.
Yes, ma'am. Yes,
Yeah,
yes.
yeah, thank you. So let's start with the logbook submission part 3. I hope by this time all of you must have submitted your rest of the assignments and logbook part 1 and 2. That's what I'm expecting. And yes, we are aware that like logbook course is a credit course, which is a practical based course, which is having three kind of submission, which is logbook 1, 2, and department specific report. So logbook 1 and 2 are your internal assessment, okay, which means these are evaluated inside under the university, inside the institute. This is considered as your internal submission. And logbook 3, which is a department specific report, is considered as your term and submission. Term and submission means like you will be evaluated and getting your term and exam marks on this report. Okay, so there won't be any separate examination for logbook course like other theory courses, hospital principle and practices of management, hospital planning and management of services, or public health, right? The rest of the courses will be having your written examination followed by Viva. But for this program, for this course logbook, there won't be any examination. Your submission, department specific report shall be considered as your term and submission, which carries 30 marks, and the timeline is like 15th of April. So let's begin with the preparation of logbook 3. If you have any query, you may write in the chat box or you may unmute and ask in between also. Okay, so as you are already visiting hospitals or most of you are already working in the hospital. So for this preparation, the hospital, you have to select the critical areas of the hospital. You have to prepare this report considering three different departments of a hospital. You may take any one OPD. Don't ask question like, can I take two medicine OPD and OBGY OPD as a two departments? No, medicine, you can take any one OPD, ENT OPD, Ops Gynae, or medicine or surgery. Okay. So you have to take any one OPD. You have to take any one ward. If you wish to take inpatient, so you may select any one ward like the medicine ward, surgery ward, or maternity ward, right? So any one ward. And third is like any critical department, OT, ICU, or emergency department. Okay. So that way you have to select any three departments. Okay. So second is like what you have to do. You have to observe the departments under the certain headings, which are already shared with you in the format. Okay. So you may modify the content as per your requirement. You may modify the sequence, but you have to write your observations under those headings only. Okay, yes, and very important, along with this report, you will be submitting your no plagiarism certificate, means like the format is already provided to you. So no plagiarism means it is declaring that you have not copy pasted content from any of the student, or two reports of the student should not match. Okay, so here in that certificate, you are declaring that the content written by you is not taken from anyone's submission. Okay. And along with this report, you have to submit the certificate of completion. Okay. So these are the three requirements. First is you have to visit hospital, any three department. Okay. So you may include any, you may also take ICU, NICU, PICU. So don't take NICU, PICU. Okay. So I take any one intensive care unit. You may take any one operation theater. You may take any one IPD, any ward. You may take any one operation theater. Yes, and along with this format, we have shared with you one department, that is the medical records department, which is like a sample format, like how you are supposed to prepare the report. So my request to you all that like don't use don't collect data from medical record department, because our previous students of it is our observation that previous year students have copy pasted the entire content, and one department is already done for them by us only, because we have given you format, we have given you certain requirement also, right? So they are copy pasting that entire medical record department as it is and submitting to us. So my request to you that do not use medical record department as a one of department from three. Okay. So and yes, and along with this certificate, this co submission, you will be giving your certificate of completion. Okay. Okay. So first is a yeah. So there is a okay. So logbook 3, you have to do observations under these heading which are available on your screen. So logbook 3, if you are selecting one department, okay. So you have to write the area of the department and location of the department. So let's take if you have selected anyone OPD. Okay, so you have to see like where that OPD is located. It is not like that the OPD is far away from the reception area or the registration area, and your patient has to come to the reception area and he has to visit to that particular OPD. He has to go far away from that the main entrance area, and you have to also see nearby if there is OPD, so investigation or the lab should be nearby or walking distance, because after OPD, usually patients are being suggested for few investigations. They are being asked to purchase medicines or sometimes they go for the IPD. So IPD, again, they have to come to the registration and they have to fill the form. But for after OPD, usually patient will go to the pharmacy or for doing their investigation. So it should be nearby. It should not be far away. That patient has to go to one place and then he has to go to other building, and third, then he has to go for the buying medicine at fourth building, right? So that way it should be that way, but in your hospital where you are visiting, where it is located. Okay. So if you are not finding all these things in alignment, then yes, there is a gap, right? So you may suggest in your shortcomings section, you may write that the investigation or the pharmacy is far away from the OPD area, right? So that way you may do write your suggestion. So next is a staffing. So staffing is like if the OPD is of like a if it is a medicine OPD, which is usually heavy, right? So in medicine OPD, if it is a the area is very small, so it is like difficult for the patient to accommodate in that particular area, right? So staffing should also be according to the load of the OPD, right? So comparing that particular OPD, so there should be 2 or 3 consultants should be taking these patients, right? So nursing staff should be available, class co-workers should be available, right? So staffing also you will write down. Layout sections within the department. So, okay. So if at all it is available in your particular department, then yes, you can take a picture and you can attach that under this section layout. Okay, you can take an image and paste it in the your report. Zoning of the department, if applicable, zoning is specially applicable in the ICU, operation theater, or the CSS department, right? So you have to write like how it is mentioned, what they are labeling to that particular every zone, right? So if it is available and applicable to that department, yes, you should mention it. And you may take a picture or you may define it, right? Or you may label it like what they are calling to the clean zone or sterile zone, right? So, yes, next is a waiting area. So, waiting area if applicable. If usually it is in OPD and IPD, the waiting area is applicable. So waiting area should be sufficient pertaining to the number of number of patients visiting to that particular OPD. Okay, so waiting area whether is sufficient or not, or patients have to stand, and there is a chaotic situation is created, like there is a huge traffic is there, right? So that way you have to see whether the waiting area is appropriate pertaining to the load of the OPD. Flow of activities, like what are the activities which are happening in the department, you have to mention that also. Okay, adjacency and the connectivity of the department. Just now we talked that like the departments which are located and required to be located nearby that particular department are available or not. How the connectivity of that particular, if there is a ward, right? So how it is connected with the operation theater. Usually in the IPD, or usually for the surgical ward, the operation theater and the surgical ward should be connected, well connected with the lift, ramp, whatever, right? So you have to look for like especially for the surgical ward or for the OBGY ward, right? So labor room, how it is connected, like how much time it may require for patient to move from one department to the operation theater, right? So you have to see for adjacency and the connectivity also. Next is a equipment. Okay, for equipment, you have to see particular like what are the equipments available in that department. Like if there is a OPD, like how many stethoscopes are there, like how if there is a small surgery has to be carried out, right? Whether there is a small room available or not, whether the nursing staff is sufficient or not, right? So that way you have to look for the equipments. Uh, yes, and biomedical waste management. As you are aware that like every in and out, like while treating patient, biomedical waste is generated. So the color codes are been practiced in OPD, IPD, and the other departments or not. Like the whether the color beans are available or not, whether they are properly labeled, hazardous sign is there or not, right? So you have to look for how they are managing, whether the staffs are being trained. You can see like while handling patient, like whether how they are disposing the waste which is generated just now, right? So you have to check for their awareness and the knowledge about biomedical waste management. Okay, signages are very much important. Like from the entrance, only like the patient should be guided by the signages. Only patient need not ask each and every question to the person or the hospital staff, right? So whenever we are at the registration or the reception area, how may I help desk area, like where the OPDs are, the where are the wards, whether the direct directories are available at the main lobby or the reception area or not, whether the arrows are been put, where is the lift, where is the ramp, right? So these are the signages available or not, or from if the patient has consulted doctor in the OPD, right? Like where he should go, like after coming outside, there should be some label, like where the investigations, where the laboratories, where the radio diagnostic investigations are happening. Where is the pharmacy from where they can buy their medicines, and there should be exit from there only, right? Patient did not again come to that way, and he will go from the entrance again, right? So there is a like easy movement of traffic should be happening in the hospital, right? The patient should go like from one go, like the zoning kind of thing, like in the one go patient from entrance to exit. He should not again come back, and there will be like the movement of traffic should be smooth. So we talked about biomedical waste management also. So patient friendly information and the charter means like if it is a medicine OPD. Okay, or if it is a cancer OPD, right? So you have to see like what kind of in that particular OPD area and inside the consultant room, there should be like the no tobacco or awareness related details should be available on the wall. And patient friendly information means which will create a awareness among patient and which is beneficial for the patient. If there is any government health insurance scheme is run by that particular hospital, then they can put list, or they can put like Ayushman Bharat is available for the BPL population, right? So that way, such kind of information is available or not. In maternity area, like the cervical cancer related, or mother and child related, any information should be put, like importance of the breast milk, right? So that way, such kind of patient friendly information is available or not. If at all it is available, so you may put in photographs in your report. And good practices, if at all, good practices may not be available in all the hospitals, but yes, few hospitals are practicing such good practices. Like for example, like in a week, every Wednesday between happy hours are there, like between 1 to 2, whoever patient is visiting to the medicine OPD or OBGY OPD, their consultation will be free, right? So their OPD will be free. Or every fourth number of patient, or every fourth table number of patient will be discounted in some or other way, like the 10% discount or 50% discount, right? So such kind of good practices are practiced in many of the hospital. So if at all in your hospital it is happening, you can mention. And just now in the earlier only we talked about shortcoming. If at all you find waiting area is very less, or what drinking water facility is not available, right? So that way you can uh, mention it is in a shortcoming. Okay, so under these headings, you have to prepare the logbook 3. Okay, so this is regarding the medical record department. If you see, we have written the area and location of the department. Waiting area, if applicable, you have to write that. If staffing available or not, flow of activities, you may write in this sequence also. It is up to you, like how you can more creatively write your report. You can do that way also. If zoning is applicable, I have not put in photographs here, that you may put in while preparing the report. Okay, zoning if applicable, not applicable, right? So equipments, we have to write that way. Biomedical waste management. Layout section, such kind of photographs are usually available in the ward with the who is like nursing manager or the matron or nursing superintendent available. You can ask them. So signages, medical record department, like signages are entry restricted for staff, signages related to wayfinding, arrows, fire exit, fire related information, right? And good practices. I hope you can read out. Okay, the same information is already shared with you uh, via sample report. So patient friendly information not applicable, right? Because patients are rarely visiting medical record department. So shortcomings and suggestion. Okay, Sumita ji is asking one ward, one daycare with endoscopy as a department. So daycare you can write as a separate department. Okay. So so don't take then any other word, because daycare is like entire day. The same thing is happening. Only the patient is discharged on that same day, right? So better you write any one ward or daycare department.
Hello.
Hello.
Hello, ma'am. I have one query.
Yeah.
Can I ask?
Yeah, please.
Ma'am, I have enrolled for diploma in quality management as well. So in that, my project is related to MRD. So I'm as it is doing my MRD like MRD visit. So can I take MRD as one of the department because I have
Yes.
actually done the whole study in
Yes,
that.
yes, Sumita ji, you can take, but you ensure that it should not look like whatever we have written in the sample format.
Yeah.
Okay.
Yeah. True.
Yeah. Yeah, okay.
That I
Because few of the students are just editing those information or they are just copy pasting. So I requesting all like if you wish to add MRD, but it should not look like the report, the sample which we have given. Anyways, you can take, don't worry.
okay.
Okay. So shortcomings, if at all there are any, and you can write the suggestions also. Okay, and you are aware like how to submit your report in the LMS. You have to log into your LMS username password. You will click on submission and submission will be done. Okay. So if you have any query, you can unmute and ask.
Physiotherapy OPD can also be taken, right? So I can
Yes,
take
yes.
endoscopy, I can take MRD, and I can take physiotherapy OPD.
Yes. Because anyway, daycare is a kind of a ward only, right? Patient is admitting
Correct.
and getting discharged. Yes, you can take.
Okay, thank you.
So basically, these are the headings under which you have to prepare your report, and any three departments you have to take.
Ma'am, you have not included billing. So can billing be also taken? Because that is a little easy to access. Like,
So for that reason only we have not added. Anyways, you have to visit three departments. So those who are already from medical background, they are more well versed with the departments of the hospital, right? But
correct.
students, those who are non-medico, they are usually not aware with the processes of the hospital. So anyways, three departments are there. So billing, we have excluded purposely that it is not at all required because billing is a kind of like there are only if lacunae or the shortcomings are there or there are certain discharge summary or anything is pending or not completely filled by the that way only billing department comes into picture and the payment or if at all there is a health insurance the insured patient, right? So we are requesting students to visit the main critical areas of the departments of the hospital.
Okay, ma'am.
Yeah. I hope
Ma'am,
you
and post submission of this logbook 3, we will be having Viva exams as well.
no. There will not be any Viva for logbook. For rest of the theory courses, there will be examination followed by Viva.
Okay, so that will be online only, no, ma'am?
Yes.
Okay.
I hope you all have registered for the contact session. If you have any query related to anything, you can call us or you can email us. We will be shortly conducting the session to orient you about the campus of the SIU and where what will be happening. So get you acquainted with the details.